Hello and welcome back to my YouTube channel. I'm Tenzing, your host today. I want to start off this new year by wishing you a very happy new year. Today we have a very interesting topic to talk about, and we have a very renowned gynecologist with us available today for our segment. So she's a very famous doctor called Dr Arshi Siddiqui. She is a renowned infertility specialist who deals in IUI. Thank you, Dr Arshi, for coming on the channel.
Happy New Year to you.
Thank you so much. Thank you. Happy New Year. So let's talk about what your specialty is, what exactly you are.
I'm basically an obstetrician and a gynecologist, but I specialize, my interest is more towards infertility, especially IUIs. That is what I'm doing nowadays.
Okay.
Yes.
Great. So you are an IUI specialist, right?
Yeah, you can say that.
Okay, great. So what exactly is an IUI? What is the procedure? What is the full form of IUI?
Yes, IUI is artificial insemination, or it is intrauterine insemination, where we inject sperm directly into the woman's uterine cavity.
Okay. What is the difference between IUI and IVF?
IVF is basically it's in vitro fertilization, where the process of fertilization, this takes place outside the body. Like the sperm is fused with the ova outside the human body. It is done in a specialized lab under specialized conditions. But in IUI, it is basically the sperm is directly introduced into the uterine cavity. So it is a next to natural process only.
Okay.
And the cost-wise, obviously, there's a vast difference. IUI is much cheap compared to IVF, and IVF involves a lot of hormonal injections, and it's quite a complex procedure. In comparison to IVF, IUI is a simpler process.
So IUI, you would say, is much cheaper and easier process as compared to IVF?
Yes, definitely.
What is the costing in IUI in India?
In India, one cycle of IUI costs around 10 to 12,000.
Okay, 10 to 12,000, that's around 100 to 120 US dollars.
Yeah.
And so the same IUI procedure which is being done in international spaces, I don't know about the insurance procedures. Some insurances cover it, some don't. But it costs, the costing starts for around $300 to up to $1,000 per cycle. So depends on how many cycles, because pregnancy is not obtained in the first cycle itself, right?
Yes.
So when you talk about cycles, how many cycles does an IUI patient need?
Actually, that depends from patient to patient, but we usually reserve like 3 to 5 cycles of IUI should be given before resorting to the last option, that is IVF. But obviously it depends on patient. Like a patient might, if he's unsuccessful with 2 cycles, he may prefer going directly to IVF. So that is totally patient's call. But we advise 3 to 6 cycles of IUI.
3 to 6 cycles.
Yeah, definitely.
So just imagine if one cycle costs you around $300 to $500 up to $1,000, the same cycle, 3 to 5 cycles, you said it'll be around 5,000 US dollars, which is a very expensive amount, a number for patients who is not able to cover the cost of the insurance. So what exactly, who is eligible for IUI?
IUI is basically recommended for couples who are not able to conceive through natural means after trying for conceiving, after having an unprotected intercourse for 1 year, basically. And that involves also the patients who are not able to conceive due to low sperm count, low motility, and like in the female there are other issues. If there is any PID, or if there is PCOD where the ovarian reserve is low, in that case we usually give fertility medicines, and that is combined with IUI, which gives a success rate of around 25%, which is good enough, I think.
So when you say that an IUI patient is basically a patient whose partner is the husband, meaning who has a low sperm count, whose sperm motility is low.
But for IUI also we need a basic, like motility should be around 25, minimum 25% motility should be there. But even with the sperm count as low as 10 million, fertility have been seen to be achieved. So yes, we can go for IUI in those patients.
Okay. Okay, so a patient who's abroad, you know, I deal with a lot of international patients. So what exactly, when a patient is coming for an IUI, how long does he need to stay here for?
Basically, the process of IUI starts on the second day of the period, where we do an ultrasound on the second day. Then if the scan turns out to be normal as per our guidelines, then we start the fertility medicines from the day 3 of the period. We give it for 5 days, and then we do a follicular monitoring to ensure the day of ovulation. On the day of ovulation, we inject the sperms directly into the uterine cavity. So basically, from day 2 to usually ovulation takes place around 14 to 16 days. So you can say roughly 2 weeks stay is required for international patients.
So 2 weeks to 14 days is what we need for a patient to come here. We start with the ultrasound monitoring, as you doctor said. With the monitoring, the chances of success rate of the IUI increases, right?
Yeah, definitely.
So we need the patient to be here, and then once the monitoring starts with the medication, we undergo the IUI on the 10 to 14 day, depending on the ovulation. So what is the success rate, doctor?
Success rate actually depends on the age also. If the female is less than 35 years of age, the success rate is more. It is around 25 to 30%. But if the female is more than 35 years of age, the success rate is around 10%.
Okay.
So there is a difference.
So the reproductive rate is very important.
Age is very important. Reproductive age is very important.
Age, yeah. Okay. So that's a very lot of information we just had with the doctor right now. Before we sign off, what are some keys to successful IUI? What would you suggest?
Age, as I've already said, age is very important. Second, a good semen wash. That is very important. So you have to get it done from a good lab.
We have our own in-house lab.
Yeah, and obviously we do all the other tests, like tube should be open. You can't do IUI with the closed tubes, obviously. IUI is contraindicated in patients with blocked tubes.
Okay. Another question we had was IUI versus a normal baby. IUI baby versus a normal baby.
There is no difference as such in the babies.
So it's exactly the same.
It's the same. It's the same. Yeah, you are just aiding the sperms to reach the, the ova. In IUI, you're just helping the sperms to reach the ova. That is what you are doing.
Okay, great.
Yeah.
So these are the normal important key points I would like to talk about IUI as discussed with Dr. Arshi. We had a few patients who traveled across the Middle East who came here for an IUI treatment with us recently, and she had a good success rate, and she was basically confirmed pregnant. So that was a good indication of our IUI treatment. But I would like to sign off with thanking Dr. Arshi for coming on my YouTube channel, and
thank you so much for having me here.
I'm very happy that I interviewed doctor, and yes, please watch out for my next segment. We will talk about IVF next in the next segment. All right, signing off, and please subscribe to my YouTube channel. Thank you so much.